Thank you for checking out this video. We're going to be talking about Pointe Readiness, and this information is geared specifically for dancers and dance parents. What we're going to be talking about today is a lot of information about what dance instructors and dance medicine professionals consider about dancers and whether or not they're ready for pointe. We're going to be talking about a few things that are specific to the instructors or medical professionals that we won't get into deep detail about because that is a topic for another video or another course, but I did want to share this with you. My name is Dr. Alyssa Arms, and I am a physical therapist and owner of Back in Step Physical Therapy. I do want to share a little bit with you about who I am and my background so you know why I'm here talking to you about this. So first of all, I have a doctorate in physical therapy, and I'm also a board-certified orthopedic clinical specialist. That's what that OCS is behind my name. It basically means that I am a specialist in all things muscles, bones, joints, etc. Like I said, I'm owner of Back in Step PT. I'm also adjunct faculty or guest instructor for a Doctor of Physical Therapy program, a high school pre-PT program, a School of Traditional Chinese Medicine, and a master's program for dance education. I'm also a member of a lot of different professional organizations, including several for dancers and around dance medicine. And you can check out more about all of this on my website. Besides that, I've also been a dancer for over 30 years. I started at the age of 3. So I am trained in ballet, pointe, tap, jazz, hip hop, salsa, West Coast swing, and have actually been a national circuit West Coast swing competitor since 2010. So I have a lot of dance background on top of my physical therapy training. One fun fact that I want to share with you before we get into all of these other details about Pointe Readiness is that ballet on demi-pointe puts up to about 4 times your body weight through your foot. Once you go on pointe, on full pointe, it then puts 12 times your body weight. So it puts a significant increased amount of stress through the foot and ankle by being on pointe versus not on pointe. That's why all of this information is so important to consider for a dancer's safety and for their overall health, not only right now as they're still growing and learning and developing, but for their entire lives. Let's talk a little bit about some of the research behind this, and then we'll go through the actual recommendations. So first of all, when you look at Pointe Readiness, we always consider a lot of different things: strength, flexibility in joints, balance, alignment, and then specific tests and skills like turning and balance tests and things like that. There is one particular research study from 2018 that I think was interesting that provides some good insight into how dancers who are on pointe versus not on pointe kind of compare on some different things. This study looked at about 50 young female dancers that all had at least 1 year of ballet training and were taking a minimum of 2 classes per week. Half of them were pre-pointe and half of them were novice pointe dancers, meaning that they were dancing for less than 2 years. What they looked at were a variety of tests on strength, endurance, and balance. And what they found at the end of the research study was that the group who were dancing on pointe tested significantly better on most of their tests compared to the non-pointe group or the pre-pointe group. So we see that there is a difference in strength, endurance, and balance between the three. For age, we want to consider age as one of several factors as to whether or not a dancer is ready to dance on pointe. The most common recommendation in medical research is 12 years old. You sometimes will see 11, but that's considered more of the exception and not the rule. Why this age? So there's 2 reasons why we consider this. One is because of the bones of the foot. We know that they finish developing somewhere between the late teens to early 20s, but there's a lot of variation from dancer to dancer. The other thing is the growth plates. So it's an area towards the end of long bones like your femur or your thigh. And this is the space that actually is where growth occurs once a dancer or a child is going through growth spurts. We know that if there are certain irritations or disruptions at that growth plate, that it can affect how the dancer grows. And sometimes it can be different side to side depending on certain injuries and things. So what we want is we want to be able to be close to when some of that development is finishing, but not necessarily wait until it's completely done either, because we want to influence a little bit to be able to reach our dance goals also. So suggestions from the research recommend at least 12 years old. And one really important thing here is that the shoe fit is appropriate. So dancers need to be fit for their pointe shoes, and they need to be fit by a good professional. Because their feet are not finished developing and other bones are not finished growing, things are at a higher risk than if all of that is done growing. That means that those shoes, which we know are already hard on our feet and bodies, need to really be the right one for that dancer to support them where they're at to keep them safe and healthy. Besides age, we also consider years of training. Most research recommends at least 3 to 4 years of ballet training, and that's usually after the age of 8. One thing that's interesting here too is that other forms of dance or mixed ballet classes, like when you're doing a mix of ballet and tap in a class, should not count towards that total. So overall suggestions here are at least 3 to 4 years of ballet specific training and at least 2 to 3 hours of dedicated ballet specific classes per week. We also look at foot and ankle flexibility. What I'm looking for is full plantar flexion or a fully pointed foot. And just for reference, the normal population, so non-dancers, we expect a normal motion to be about 45 degrees. So when you're standing on a flat foot on the ground and you kind of point your foot down a little bit, we want to get to 45 degrees. For professional adult ballet dancers, it gets to 113 degrees. Now, of course, we do not expect our young ballet dancers to meet 113 degrees, but I want them to be a lot closer to that than they are to the 48 degrees for the non-dancing people. Strength, we're looking for good strength in feet, ankles, and trunk, and considering things like, can they hold their balance, especially when they're in passe on demi-pointe or doing a grand plie at center? Can they maintain proper posture throughout class? Can they comfortably make it through class without significantly losing form and technique? So the 5 primary things that we're looking for are age at least 12 years old, and if they're any younger, and that means 11, not 8, they need to be that much better in their strength and technique. For years of training, we're considering 3 to 4 years of ballet training after the age of 8, with 2 to 3 hours of ballet classes per week. Foot and ankle flexibility, they need to get to a certain point, and this can be assessed by dance teachers or a medical professional. Strength, considering those questions about posture and control, and again, another test that can be done by dance instructors or medical professionals. And then we also look at stability using 3 primary tests that are also done by teachers or professionals. Another thing to consider is doing a medical screening as part of this. Now, as a medical professional, some of the things that I look at, besides all of the stuff we've already talked about, are past and current training habits, dance history and genres, injury history and general health and menstrual patterns. I also consider nutritional practices and weight, not from an aesthetics purpose or trying to fit in with a certain body type or that kind of thing, but that information does give us a lot of information about overall health of the dancer and how it's functioning to make sure that the body is supported while doing these things like pointe that are extra stressful to our bodies. I also look at posture, specific technical ability, flexibility, mobility, and strength from essentially head to toe. And one thing to consider too is when a dancer has been put on point, when they hit a growth spurt, it may be beneficial to temporarily take them off of point during that growth spurt, because we know that the muscles' strength and coordination are affected during that time, because not everything has had a chance to catch up with one another. So during that time, dancers can continue developing their strength and control, working on demi-pointe and focusing on a strengthening program, and then go back to point when they're ready. Some other things in case you're ever wondering, should I send my dancer to a medical professional? Some things to know. If they're complaining of pain, especially if it's lasting more than a week, if they have swelling or loss of motion or numbness along with it, if it's waking them up at night, if it's present when they start an activity or gets worse with activity, or it causes compensated movements, they start moving differently because of that pain. Some other reasons to send your dancer to a medical professional: they're frequently injured and it seems to take a long time to recover. Maybe they're more flexible or more strong on one side than the other. They're hyper flexible. Maybe they're working hard, but they're not showing the expected progress for the amount of work they're putting in. Or, of course, if they're injured. If you want to know more information about how medical professionals like me, a dance medicine physical therapist, can help your dancer, check out my website. It's www.backinsteppt.com. I'm located in Centennial, Colorado. I offer physical therapy services to recover from injury, surgery, or pain in Colorado. And then for any of my wellness services, that all is available outside of Colorado as well. I offer things like annual dancer physicals, a performance boost program, and Pointe Readiness assessments. So you can find out all of that information and a lot more on that website. You can also find me on Instagram and Facebook, as well as YouTube, all with the handle at @BackInStepPT. I look forward to hearing from you and answering questions that you might have.